Hi, I'm Kelly from North Shore Eye Care. I am sitting today with Dr. Jeffrey Martin, and we are going to discuss new technology that we have here, and we're very excited to be able to offer it. iDesign is technology that we are the only practice on the East Coast offering right now, and we are 1 in 12 in the entire country that's able to provide this to our patients. So I asked Dr. Martin to sit down with us and just tell us a little bit about how this technology works and what makes it superior to other technology available out there.
Thanks for coming in for the chat. So we are very excited to be the first eye care practice on the East Coast to be able to offer iDesign, iLasik to our patients. So when it comes to LASIK laser vision correction, we're currently able to correct nearsightedness, farsightedness, astigmatism, which is excellent. It's great to be able to provide these corrections. And we've always been excited to provide the very best technology available. So what that means is we only do blade-free laser vision correction. We don't use blade machines for anything. We only use custom laser vision correction. And so what custom means is that each patient's fingerprint is unique to them, so is their visual system. In the old days when we did LASIK, we used to only be able to correct the numbers in your prescription, in your glasses, nearsighted, farsighted, astigmatism. But today everything is customized. So we have a machine. The old one was called WaveScan, the newer one is called iDesign. And iDesign obtains an image of your visual system, which then digitally transfers into the laser. Now that's safer because there's no manual input of numbers. It's technology to technology. But also the wavefront iDesign technology is able, what it does is it gets a custom fingerprint of your vision, your actual visual system. It comes in, it looks like a waveform instead of just a number. So you can have 10 patients that all have a -2 contact lens, but they all have different visual systems, fine irregularities, things beyond nearsighted, farsighted astigmatism, optical principles, physics, things that like coma, trefoil, spherical aberration, higher order irregularities in your vision that we correct now that we can never correct before.
Right.
So we were doing wavefront guided custom LASIK bladeless before, and we still are. So what's changed?
Right.
Well, the WaveScan machine that we've been using for 15 years or so is just that. It's 15-year-old technology, and it's good. But technology has improved. So the iDesign, which we got, I think, the 3rd unit in the United States, it obtains an image which is much sharper than the previous. So the resolution is 5 times better. The data points are over double. So the old WaveScan, I believe, had 650 data points. This has 1,200 data points. So when you think of old, it is the same technology that's used in astronomy and looking at planets, looking at galaxies.
Right.
So if you think of the old telescopes, you would get blurry images. Now you see the images in space and they're vividly clear. Well, that makes a difference. So the same technology that goes into that is now going into the iDesign, so that the image that we're creating of the visual system is so much better that if you can get better data in is better data out.
Exactly.
So these lasers are able to correct to the finest detail, but they can only correct what they can see. So now that we can see much better, we can correct much better. And we are thrilled about that because we think that this is going to be a huge change. We've already seen it in the patients that we're treating. 20/20 is sort of a objective measurement of vision. I can see 20/20, I can see 20/20. But clarity of vision is something that is more subjective. So we find that patients are saying, wow, this is so clear, it's amazing. So I think that better data capture is translating to better visual results, and we're tracking those results, and we're going to present them at the next American Academy of Ophthalmology meeting in Las Vegas. I mean, I'm excited to do that.
People are referring to it as seeing in HD now. You know, the way it's correcting.
Right. I think it's correcting better, and it's the brain of the LASIK procedure.
Mm-hmm.
So the laser is the instrument that we use to correct your vision, but the brain is the data that's collected from the visual system that drives the correction. So if you have a better brain, you're going to have a better delivery, and that's what it produces.
Okay, so some of the differences, prescription, it's treating higher prescriptions. How
Right.
is it? Like, what are some of the differences from traditional, like, wave scan technology?
Great question. So because the instrument is more accurate across a broad range of eyes, we're able to correct people that we were not able to correct before. So
more LASIK
we're able to correct a lot more astigmatism. We're able to correct a lot more nearsightedness.
Mm-hmm.
So the size of the prescriptions at times, I mean, we do a lot of LASIK. I've been doing it for 18 years. We do over 100 of these every month. And there are many patients that come in that I just am not able to correct because the technology couldn't do it. But a lot of those patients now are going to be good candidates. In addition, the old wave scan was really approved for age 21 or above.
Right.
But this iDesign is approved for age 18 or above.
Mm-hmm.
So because the technology is better, the approval from the FDA was way wider, which just means more people can benefit from what we provide.
Right. So I would imagine, too, patients with higher prescriptions, maybe having LASIK before, would get okay results. Now they're more likely to see much better results as well, right?
It's really hard to quantify that because patients that we were treating before were happy because they you only know what you have. Mm-hmm. So that's the toughest part about improvements in an already great procedure. That your patients before were saying, "Thank you so much, it's wonderful, oh my God, you've changed my life," and patients now are saying that. But we're able to see better contrast, better clarity, less concern with nighttime vision, less concern with glare at night, less concern in dim lighting. It's a better technology, and I think it's going to make a big difference.
Yeah, and it's exciting and great that we're the first in this area that's able to offer it.
Listen, again, I've been practicing for 18 years. I've been around a long time. I'm the managing partner of this practice. We have an 8 locations, 16 or 17 doctor practice and growing. But there are a few things. There's many technologies, laser, cataract surgery, some other technologies where I did not want to lead, because some of these technologies, you just want to make sure they're okay in the community before you adopt them. You want to only bring what you're sure is going to be better to your patients. So it was never my goal to be the first.
Right, I've heard you say that.
But in this setting, I think being the first is excellent because it's already a proven technology that is just improved. And
I've heard in Canada and in Europe it's been done for a while, I think.
Right,
so,
right. This country usually lags, which is safe. I mean, it's safer for our patients, but at the end of the day, this technology is just a better version of what has already been done. And I think, the slow adoption from some eye doctors has to do with the cost involved. And one thing about our practice is we never spare a cost for patient, for things that are truly better for the patient. So we didn't even think twice about acquiring this better technology. Unfortunately, the room we have it in is like 6 by 6. It's a small room designed for the original wave scan,
right.
and this is a bigger machine, so that's a challenge. But we've been using it for over a month now, and our patients are really impressed, and we're really impressed. And the machine, the iDesign machine, it gives you so much information, and information rules the day. Mm-hmm. So we're getting corneal topography, which is the shape of your cornea. We're getting corneal steepness readings. We're getting a wavefront refraction, which tells us what your eyeglass prescription is.
Right.
We're getting the wave scan, which is the aberrometry, which shows your pattern of your visual system, and your pupil size. And one thing about this technology also is that the last wave scan, the smallest pupil you could have, by pupil I mean the diameter of the black part of your eye, the center part had to be 5 millimeters or greater, and this one is able to get a full millimeter less, which is 4 millimeters or greater. Now, 1 millimeter doesn't sound like a lot to us,
Right.
but in the world of eye surgery and eye care, 1 millimeter is a lot.
Right.
It's a lot, and so I'm excited about it. I think it's going to be a great improvement in what we provide.
Thank you for sharing some information about it. If you would like to set up an evaluation and experience iDesign, please give us a call and we would be happy to do that for you. Our number is 631-265-8780. You can also check out our website. It is nseye.com. Thanks.